It's Dr. Nami again, and I wanted to share with you some more information about what we do in our practice and how we help patients like you. So I am going to share with you a story about one of my really dear patients. His name is Johnny. Wonderful guy in his 60s, and came to me because he said, Dr. Patel, I've been going to the dentist every 3 months. I have this bitter taste in my mouth, and they told me I needed like 6 cavities. And I don't understand that because I go in like clockwork. I take care of myself, and I don't understand what's happening. How could I have all these cavities just appear within 3 months? And so I said, okay, well, let's take a look. The first thing we started is we did his oral microbiome report. And because he was in his 60s, the second thing that I did look at is going to be his airway. So I'll talk to you a little bit more about that down the road in another video, but I wanted to focus on his gums because that was his chief concern. So here we go, okay? This is his oral microbiome results. This is Johnny. And so again, we're looking at green light bacteria, yellow light bacteria, and red light bacteria. In his case, he's 60 years old, so I'm really concerned, right? For two reasons. Number one, obviously the red light bacteria make me concerned off the bat. Second of all, what makes me really concerned is seeing these guys above the threshold. When I see that bar, which is a quotient, right? So 10 to the third power, 10 to the fourth power, 10 to the fifth power. When we see that we have a lot of activity, a lot of bugs in his mouth. So I do not want to see that. So I had him come in. We did his well, obviously deep cleaning, laser ozone in our protocols to figure out exactly what's going on. He actually had some dry mouth as well. So we did talk about more dry mouth therapy and things like that. And about 6 to 8 weeks later, this is the results that we're looking at. We have a 59% reduction. Not 100, that's okay, but we're looking at a 59% reduction in bacteria, which is really awesome to see. And also, some of these guys are completely gone, which is amazing. Like there's little PI, CR is completely gone. These are below the threshold. These guys have significantly lowered. So we're really happy to see the results of this case. He still has a little bit of red light bacteria, mainly because we've discovered, he's got apnea, and we do need to address that because there's no way this is going to go completely to zero if he's continuously mouth breathing and creating a dry environment. So we're addressing that down the road. But just again, like looking at the results of all the red light bacteria, just bringing them down the threshold, bringing these down to the threshold is amazing because his biggest concern was, Alzheimer's. He's 60 years old, doesn't want to, deal with Alzheimer's. We got rid of the PG completely. He was also concerned about acid reflux, where we've got some PI coming from the belly up. So we've reduced that completely. So it's been really nice to see his, to see his approach. And also he comes in and says, my mouth feels fresh. He's super happy about the staff. He's learned so much, got all his questions answered, and he really got a holistic view of what was going on with his body. He is not crazy. Everything he was feeling was accurate and on point and needed attention. So I'm so grateful that the universe directed him to our doctor practice so we can help him. But it's so wonderful to give people results that really are life-changing, to know that we've reduces chances for Alzheimer's, heart attack, diabetes, cancers, and even helped him looking at his apnea, which has been misdiagnosed or underdiagnosed or not diagnosed at all by the medical profession, and really looking at how can we make sure that he lives a long, healthy life. So really excited and really excited to share this information with you. If you have any questions, please feel free to reach out. We're here to support you. 415-433-0119, and I look forward to taking care of you.